I've been dealing with pain for over a year. I had 2 back surgeries. The last back surgery I had was a year ago, February, which is just a year ago. And I had an issue with my thigh and my leg, and I couldn't stand for more than 5 minutes, and I couldn't walk more than 5 minutes. And I had to sit down, and I was in excruciating pain. I did. I had a laminectomy on my lower back about 6 years ago, and I have stenosis of the back. And when I went to a pain management doctor, he told me that I needed to have surgery on my right side when my issue was really on my left side. But I did have the surgery on my L3 and L4 on my back. And ever since I had the surgery, that's when I had the problem with the thigh and the pain.
Judy is a super sweet 70-year-old woman. She came to us, she couldn't stand for more than 10 minutes or walk for more than 10 minutes with horrible low back pain.
Actually, I've been to many doctors over the last 5 years, between pain management, where they gave me shots, hoping that it would go away, but it never went away. I couldn't get it away. So, and that's 2 pain management doctors, and the 1 pain management doctor recommended the surgery. I really did feel they were listening to me. It's just that I don't think they knew what to do.
This all started in 2015. She had both of her knees replaced, and that's when her low back and thigh started burning. In 2019, she had her right hip replaced. In 2020, I believe, she had a laminectomy at L3, L4. So whenever I see somebody that's older or even younger than 20 years old per se, they're usually not the best fit for having adhesion. Our ideal patients are between 30 to 60 years old, have had pain more than 6 months, have seen at least 3 doctors or therapists without relief. When they're younger than 30 or younger than 20 especially, or even younger than 10, we have helped those patients, but it's much less likely that they have adhesion. When they're older than 60 or older than 70, they have a shit ton of adhesion, but they also have a lot of degeneration in their spine. So her MRI report and her MRI showed that she had a curve in her spine, a scoliosis. She also had an anterolisthesis, where one of her vertebrae was degenerated and slid a little bit forward. And she had stenosis, which means that her spinal column was narrowed. So I wasn't sure if we were going to be able to help her. We did the exam and found a lot of adhesion.
Emotionally, it was very frustrating because I'm very active. I like to be active. It was very, very painful. And when you have to sit after 5 minutes of standing or walking, that's an issue. My daughter works around the corner. She has an office around the corner, and she saw your advertisement in your building, I guess. And she said, "Why don't you try them, Mom? You tried everything else. Why don't you try them?" I was very skeptical. I'm saying, what can they possibly do for me? There's just nothing. I felt I was doing everything I possibly could. But I figured, okay, actually my daughter paid for this, so I said, I'm going to go with this flow. So I came in, I was very skeptical but open-minded.
But I just want to go over what the stenosis issue is because it's kind of scary when people allow it to get that far. This is a vertebral segment sliced through, going horizontally through someone's body. This is the disc. This big octopus-looking thing is a bone. These are 2 facet joints. Here's the spinal column. This is empty space, and here's the spinal cord. So what happens as we get older is our discs start degenerating. They start becoming thicker and wider, and they start pushing. The jelly and the outside of this start pushing into the spinal column. What we also have happening as we put stress on our body and our bones, the bones start thickening. So they start thickening in all directions, around the joints, they start thickening and closing in on this spinal column. This is just the nature of having bones and living on planet Earth. So stenosis is what happens when this spinal column, right in here, starts to narrow. Stenosis means narrowing. And one of the major issues that also happens is there's a ligament that lives right here, and it goes down the back of the discs, down the spinal column, and it starts crimping and thickening in here. This is also why I like the shockwave treatment, because the shockwave is actually able to get deep enough to treat that ligamentum flavum in there. So because of the nature of the stenosis, we don't always get relief from results, just because even if somebody has a lot of adhesion, they also have a lot of bony and joint degeneration in there.
Everybody was so friendly. They were really, really so friendly, and they explained everything as they went along. So I felt very comfortable. Oh, he's wonderful. He's absolutely wonderful. You know, I didn't understand the treatments. Now I understand the treatments because I've gone through them for a few months now. I think it's 2 months now I'm going on. And the difference I feel is amazing. It's absolutely amazing. I can walk up. I can walk straight. I'm standing up. I can walk for an hour. I can stand up for an hour. I've done my baking and everything I did for the holidays. I feel wonderful. At first, they were very, very interesting. I thought they were giving me a tattoo, but they didn't. It's very tolerable. It really is very, very tolerable. But it's very rewarding. The expertise here and the method that they use is unbelievable. I mean, they're working on my knee and my hip and my back, and I feel so good. I have no more knots. I don't know how else to explain that, but it's wonderful. When I first came in, they put me on a vitamin regimen, and they give me exercises, and I've been meditating, and believe it or not, they all go together. I try to meditate every day for about 15 minutes. And I was not into meditation before I came here. It helps me with my pain. And I don't know if it's really pain management. I can't really say that, but it relaxes me and it makes me really think about, you know, where the pain is and how I can work it out.
But fortunately, we just saw Judy. She's about to move back to Florida. She's 19 visits in. She's 80% better. She's able to walk for an hour with about 2 out of 10 pain after an hour, where after 10 minutes, it used to be 8 or 9 out of 10 pain. And thank goodness she had a ton of adhesion in her low back and her hips, her thighs, her knee. And she's feeling much better, and she's very grateful. And I'm glad that she found us.
Wonderful. I can walk. I can shop. I haven't shopped in years. I can shop, I can walk, I can play with the kids, my grandchildren, I can play with them. Please try it. If you have any questions at all, just please try it. But you have to listen to the whole program. Anybody who's been to many doctors and still has pain, because I've had many surgeries, and you still have pain after that, try it. I feel like a different woman, to be honest with you.